يا هلا وسهلا فيكم في بودكاست سوالف جدية في الجلدية عبر الأميال مع لوريال. اليوم إحنا في لوريال ديرما أبو ظبي. اليوم أستضيف دكتور دوراج ديفز consultant dermatologist in الكويت. هو استشاري الأمراض الجلدية والتجميل في دولة الكويت. Hi Dr. Siraj.
Hello doctor.
You told me behind the scenes that you were practicing since 20 years.
Yes.
So you've seen it all.
Kind of.
I have a question. It's getting better now, but always we've seen people in Kuwait, they do over cosmetics, fake, more fake. Why especially in Kuwait?
Actually now the demographics is changing now.
Yes.
The whole trend is changing
Yes.
now. Now we are coming back to the
Alhamdulillah.
natural self.
Thanks
now.
God.
Yeah, thanks God actually. Yeah, even the practicing doctors also promoting now natural self and natural results. Yeah. So we are finding it very easy now not to convince more and convince less. And yes.
Yeah,
that's a trend now.
Before 10 years, I remember when they say Ramadan is coming, so the series of Kuwaiti series, especially in Ramadan, a lot of fillers and Botox and too much makeup. Now they are starting to be, the trend is to be as natural as it
possible,
gets, as possible, to look your age in a decent way.
Exactly.
Before it was so exaggerated that it was really, really disturbing.
Especially after the advent of biostimulants, now we are finding it a big trend that people wants to be more
Thanks
natural.
God to biostimulants.
They're more working on the quality of skin rather than volumizing or distorting the faces.
And now the new generations are really afraid of people who are overfilled, the pale face phenomena. And the overfilled people, they have no place to fill.
Exactly.
So we are going to the right direction again. Thanks God for that.
What we have seen is now the younger generation have a lot of questions to ask, and they are very cautious to enter the field of aesthetics. But at the same time, step by step, they are learning the tricks, and they are, learning how to look more natural rather than, going for volumizing and doing.
Correct me if I'm wrong. Why Gulf region, especially, they like to do lip filler? Why do you think that is popular? I see patient who has scars, pigmentation, acne, whatever, and she's coming for lip filler. And she thinks that it will make her problems go away. So what do you do in this situation?
Like we say, eyes are the, the way to the soul or way to the inner beauty. Similar to that, the lips are also actually gives a lot of importance because of the smile which generates the happiness which it can produce by giving a good smile. So I feel likewise, like the eyes, lips have got a major role to play for the beauty. So I think when you work on the eyes as well as on the lips, I feel overall beauty is enhanced actually. That's what I feel. Probably that has been perceived by the Middle Eastern.
But I think I would negotiate with the patient first.
Exactly, yeah. True. I'm not saying we are pushing fillers for the lips or volumizing the lips and stuff like that. But when we look at a full face rejuvenation or work, when we see only the upper 1/3 if it's worked and the lower 1/3 is left alone, there is a big difference in leaving that alone. So I think we should work on both sides, both upper face and the lower face. That gives overall beauty.
What procedures Dr. Siraj say no, I will not do?
Over exaggeration of anything on the face.
No.
We aim
certain procedure. You say no, I don't do.
Yeah, if the patient is asking for anything which is which doesn't reflect to their natural beauty, I would definitely say no. I would definitely say I'm not going to do that. I'm not doing it. You can actually approach any of the doctors, but from my side, no. We don't actually, you know,
Do you do nose filler?
we do nose fillers.
Do you do
Only for corrections. Only for
Yeah.
correction if the patient has a defect or something.
Do you do dimples?
Dimples, no, I'm not doing that.
So that's a thing.
Exactly.
You don't know.
No,
you
actually,
don't do.
Our department is actually a group of plastic surgeons and dermatologists together. So we do have a very good rapport among doctors. So we have certain areas of patients we do refer to plastic surgeons. So we do, you know, give them the chances of correcting those. We don't want to interfere.
Really? Yeah. That's nice to have someone to.
Yeah, we know our borders, we know our, you know, territories. So apart from that, you know, we refer to plastic surgeons. Yeah.
So, what is your favorite regimen for skin routine therapy?
Depending on the case, actually. If the patient has an oily face or a dry face, or the patient has an acne face, or a patient has a sensitive face. So depending on that, we formulate a routine, including toners, cleansers, and things like that. A night cream and a day cream, definitely including sunscreen as well. So it depends on the case. Depends on the case. I cannot just right away say there's a perfect formula for all faces. You know, it's difficult to say that way.
Yeah,
so
it should be customized.
Customized. So we do actually spend a lot of time in consulting, talking to the patient, and coining out a very good routine for them.
So how you explain to the patient if she's saying I used retinol, then it's flare my acne in the beginning. So what do you tell her?
Yeah, retinols can actually sometimes, you know, induce a bit of acne. So we'll ask them to slow down, not use. If the patient is actually using retinols for, let's say, for anti-aging purpose, definitely we'll ask them to slow down, not to put too much moisturizers on the top, to occlude or something like that. Definitely is required when the retinol causes dryness, but a very light moisturizer.
So what message you want the new generation dermatologist to have? What message, if you knew it before, would make your life easier with patients after 20 years of practice?
My advice to the future or upcoming dermatologists is we have to find a perfect balance between aesthetics and clinical. And we have to have both.
Yes, thank you very much.
If we can have both, we will love it, the patients would love you more, and we can actually generate wonderful results.
Exactly. That's a really nice message.
So I
this
feel,
is gold.
Yeah, we have to have both clinical and dermatology, clinical and aesthetics in our practice.
Thank you very much. It has been a pleasure talking to you. You are reasonable, wise dermatologist. I learned a lot from you. Thank you very much. It's an honor to have you.
Thank you, Doctor.
Thank you.
Thanks a lot.